Welcome. In this brief tutorial, I will demonstrate how to use OnSight's MIP YOLO model within a pathology digital slide viewer to help you objectively quantify KI-67 in real time as part of your routine workflow. By the end of this video, you will learn how to seamlessly integrate OnSight's MIP YOLO model and learn how easy it is to quantify KI-67 in real time objectively. Before we begin, you will need two things for the purposes of this tutorial. First, we will need a digital slide viewer. For this video, I will be using QPath to demonstrate, but OnSight is compatible with all digital slide viewers, so please feel free to use the one you feel most comfortable with. Alternatives include, for example, Apereo and also your own institution's digital slide viewer. Secondly, we also want to have OnSight installed and configured for our workstation. If you do not have installed OnSight yet, please follow the installation link in the description. Setting up is very straightforward and typically can be completed in just a few minutes. As always, please note that AI augments but not replaces pathologist judgment. So please use OnSight within your institution's guidelines. First, we want to start by loading our KI-67 slide in our digital slide viewer. After we have done that, we want to recommend with you starting at a magnification of 40x. And as you get more comfortable with OnSight, please feel free to change the magnification and test out different magnification settings to see what suits your workflow the best. But to get us started, we recommend staying at 40x magnification. After loading our slide at 40x and making sure the magnification is 40x, we want to go to on-site window, and this is how it should look like after you have installed it and opened it up for the first time. We want to go to model selection in the top left corner and click on our desired model, which for this video will be the MIB YOLO model. After selecting the desired model, next we want to define the screening region so OnSight knows where to look and analyze for KI-67 quantification. So basically, what we want is you're basically telling OnSight the region to look for KI-67. First, we select a screen region, and after selecting this select a screen region tool, we go to the upper left corner of the tissue region we want OnSight to look at and click once at the upper left corner. Next, we want to go to the bottom right corner of the region we want OnSight to look, and we will also click there. So two clicks in total. The first click at the upper left corner and the second click at the bottom right corner. How I like to think of it personally is we are drawing a rectangle around the area of the tissue we want OnSight to look for. After selecting the screen region, we simply go to Inference Control and click Start. It should only take OnSight a couple of seconds to start analyzing our screen for KI-67. So now we know that OnSight has started to analyze our screen, and we can move it a little bit to the left so we can see the entire region. So basically, we after moving the screen, we can see that it is picking up the positive cells in a red overlay and the negative cells in a blue overlay. And here we have the breakdown shown to us. So in this particular region, there is around 15 positive cells displayed in the red overlay and 144 cells that are negative displayed in the blue overlay. And basically, it will be around 20% positive quantification of KI-67. And OnSight works in real time and we can move around the slide, and we can see that it reacts automatically and rapidly, which will allow us to analyze and quantify the slide or the region in a very short amount of time. Furthermore, we can also adjust the specificity settings and change it to basically suit our workflow needs, as different slides might have different thresholds. And for example, if it's fainter, we might want to use a lower specificity so all the cells get picked up. So for example, instead of zero point 0.6, we can try out 0.2 for this slide to see how it will look like. And as you can see, at zero point 0.6 threshold, this cell wasn't picked up, but now that we went to zero point 0.2, it is now picked up. So we have to really test the different specificity settings to pick the one that will work the best with our workflow. So again, as we pan across the screen, OnSight will react in real time to pick up the cells and give us the breakdown as well as the results and the percentage of KI-67. So overall, OnSight is very easy to use to objectively quantify KI-67. Simply load the slide into your digital slide viewer, set the magnification at 40x, and select the screen region by clicking twice, once at the upper left corner and the second time at the bottom right corner of your screen. After that, you simply click start, and OnSight will analyze the region you selected, and you can pan across your slide, and OnSight will be there to help quantify the KI-67 in real time. And of course, as I mentioned, feel free to test out different specificity settings to see what suits your workflow the best. Thank you for watching this tutorial.